Think about the last time that your child was chronically sick. I'm sure you saw a physician within the first 24 hours. And for a general checkup, I imagine you'd expect to see someone within a week or two. I'm exactly the same for my caring children. But what if this was not the case? What happens if efficient medical health care was not part of your and my world? In 2015, 50% of the people in this world were under the age of 30, and 90% of them lived within developing countries. In these countries, typically people live in overpopulated urban areas and in remote, poor, rural areas. Unfortunately, it's the governments that are tasked with providing these people with health care. And as many of us know, these governments are often underfunded, understaffed, and unfortunately corrupt. As a result, the majority of the people in these populations are denied access to healthcare where they live. And with this in mind, we really need to deliver a new way of providing healthcare to where people live. I've lived in South Africa for the last 12 years and I've taken many trips across the continent with my family. I'm typically struck by the lack of healthcare infrastructure when we take these trips in both urban and rural areas. Now, what I mean by healthcare infrastructure, these are things that you and I take for granted. Ambulances, clinics, pharmacies, doctor's rooms, pathology clinics. These are types of things that unfortunately are absent in large parts of the emerging market. However, there is hope, and this hope comes in the form of a mobile bus. When I first saw one of these buses, I was like, it's a bus. It's a chunk of metal. It looks kind of cool. But when I went inside these buses, I was blown away by what they actually delivered. They have specifically designed optometry, dental, and medical workstations. They have internal power systems from solar and for backup generators so that they're self-sufficient and can operate anywhere in the countryside. I'm a bit of a techie guy, so when I found out that they continuously connected to the internet via satellite and 3G connectivity, I was really impressed. What this means functionally is that every medical record, every medical activity that takes place inside the vehicle is immediately available to the cloud and on data dashboards throughout the world. But beyond the physical stuff, these buses are manned by dedicated medical teams, nurses and doctors who work on the buses 3 weeks on and 1 week off. Their working conditions are made somewhat more comfortable by flush toilets, small but usable kitchens, and continuous access to Wi-Fi. And at night, they're housed within the local community or at guest houses. In order for you, the audience today sitting here in Vancouver, to better understand the economics and the impact of a medical emergency on a family of limited income, let me share the following story with you. In the Copperbelt region of Zambia lives a small family, the Maimbos, the typical Chimemba family of 6 people. The father's mostly absent, he works in the mines and comes home probably once a month. The mother, Chola, works in the fields farming vegetables and looks after the 4 young children. When their youngest daughter, Chabala, suffered from chronic dental disease, she needed to be hospitalized. And so the 2 of them needed to travel to the provincial capital, Ndola. This is a 200-mile trek which would take them on the dusty roads of Africa a full day to get there on unreliable and public transportation. When in Ndola, they would hope to wait their turn in a chaotic hospital system and get to see a physician. This may take a day or 2, and at this point, the family's losing income from the vegetable sales that Chola would typically do roadside when she was back home. Contrast this to the bus, which is able to bring services to their hometown and give a full dental, medical, and optometry service, including glasses as needed, for $45. You and I can't even drive to the doctor or take an Uber for $45, and this is the level of efficiency that these buses can bring to their schools. And ideally, these services would be paid for by an international donor or possibly an efficient government hospital program. However, as innovative and incredible as these services sound, they don't always work out. Sometimes the bus gets to the school only to be denied access to the kids. Parents don't sign consent forms. Principals don't notify teachers that the bus is there. And sometimes when they do get to see the kids, the harsh realities of undernourishment, neglect, and sexual abuse bring the teens to tears. But the truth is, this new paradigm does work. And last year in South Africa, 100,000 children received first-time medical care through this innovative solution. With this in mind, what other healthcare problems can we solve in the emerging world? Here in the West, we think HIV/AIDS is yesterday's news. But in developing countries, the disease rate is increasing by 10% every couple of years. For this healthcare challenge, there's a mobile clinic, which looks exactly as the previous bus, but internally has got a sophisticated laboratory and doctors' consulting rooms. Right now in rural South Africa, getting an HIV/AIDS test takes 6 weeks. That's from the initial blood test to the distribution of antiretrovirals or ARVs. Using the new innovative mobile approach, this now takes 90 minutes. That's 90 minutes from the initial blood sample to the distribution of ARVs, and critically, the medical staff don't lose sight of the HIV/AIDS patient who's just been diagnosed with a positive status. That's pretty amazing, but what's more amazing about this mobile solution is that men are 90% more likely to visit one of these mobile clinics than a bricks and mortar clinic. And the reason is really not something that's obvious. These buses come from outside of the community, outside of the relationships, sexual and social, that typically prevent the men from going to the clinics and getting tested. The data is already showing that the areas that are visited by the buses are seeing a reduction in infection rates. So beyond healthcare, what else can we think about that will help these developing countries progress using the same solution? Something that's very important to me and important to most of you is education. Here you see the vehicles are configured like classrooms, so they can take technology, services to promising students, and teach teachers, again, in remote areas. Think about government services, capturing unemployment data, land dispute claims, distribution of birth and death certificates, distribution of social grants. These are all fundamental for high-functioning civic communities. Think about mobile banking services and mobile savings products that can be given to people in the areas where they live. And the number one thing that people ask for when they see these buses is retail services. How can they buy consumer goods? The same things that you and I want to buy for our kids, but have this delivered into a rural area. I hope that maybe these buses could be refrigerated so we could take more products into these areas. Other opportunities like job creation hubs and entrepreneurship programs could be delivered right where people live. So if our collective goal is to facilitate rapid improvement in social and economic well-being in developing countries, it's my view that mobility has to play part of the role. And on final reflection, although these buses can deliver many things, what they ultimately deliver is hope. And hope is the first step towards meaningful change. Thank you.